You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we are joined by Georgia Decker, past ONS president and retired member of the ONS New York Capital District chapter, to discuss herbals and their role in integrative therapies for cancer care. Thanks for joining me today, Georgia.
Thank you.
To start us off, can you define an integrative health approach?
Yes, integrative medicine or integrative health approaches are grounded by research evidence and truly integrated with conventional medicine. For a long time, there was misuse and misunderstanding that was caused by interchangeable use of the language complementary therapies, alternative therapies, integrated therapies. But these are the medicine and the therapies that are truly integrated.
Why should nurses consider integrative health approaches to cancer care?
Well, we have to become knowledgeable because our patients have been using them for decades now. That for a while there was a don't tell, and then that way no one can be mad at you. So they didn't tell us what they were using. They were afraid of being dismissed. And so people just didn't tell. The other misconception was if it's natural, it's safe and it can't possibly interfere. So our surveys have become more and more specific over the last 40, 50 years, and people are now telling. And we're asking, it's our responsibility to ask if they're using any special teas, any herbs, and any nutraceuticals or foods that for specific reasons for cancer. The trick is that people have comorbidities and they might be taking something for, say, migraine headaches or a heart condition that they don't include because they think it doesn't affect their cancer treatment.
I think that's really important. I think that making sure that we as nurses, when we are doing those assessments and asking patients, are they on any medication, being very specific and asking them, are they taking anything supplemental, to make sure that they do let us know. And I think, like you said, they thought they would be in trouble if they told us or if they were taking them. And I think it's just so important to make sure that they understand that it's okay to let us know, and it's very important to let us know so that we can make sure that they are not taking something that could be harmful, especially across, comorbidities and things like that.
Yes, absolutely.
What are common herbal supplements and spices that are used to mitigate cancer symptoms?
Well, people with cancer who are going through treatment or have completed treatment have symptoms that may be related to their cancer, to their treatment. So some may be longer lasting than others, but patients use a specific herb for a specific reason. The research has been very consistent about this. So let's take fatigue because we don't know always if the fatigue is coming from the treatment, the cancer itself, or a combination of both. So one of the herbs that's very popular is ginseng. Now, ginseng has some helpful properties, but it also contains a lot of contraindications. For instance, if you have a cold and you're taking pseudoephedrine, that raises your heart rate, so does ginseng. So you don't want to do that, and especially if then you're on medications to control your heart rate. So we can get into a lot of but the truth is it's not safe for you to take right now, perhaps afterwards. The other thing about ginseng is it has been implicated as being pro-estrogenic. So there might be a longer range reason why we might not want them to take it. And I actually checked this morning to make sure it was still listed in the potential contraindications, and it still is listed in terms of being contraindicated for breast cancer, uterine cancer, estrogenic tumors. So even though it might, I guess, put Tewberry in our shuffle, what's that old commercial? It's not safe to take. And it might not be safe just during treatment, or it could be not safe for you to take ever.
So you talked about that ginseng not being safe for patients to take, especially patients that have estrogen receptors and things. What does the research show us about herbals and their influence in cancer care?
Some can interfere, some might not under certain circumstances or low doses or high doses interfere. Some would be better taken after, some would be best taken not at all in that particular patient's situation. But essentially, with herbals, we always have an overriding concern about purity. The least expensive is probably not the best, but that doesn't mean that the most expensive is the best. So the bioavailability of it, the purity so that you're not being exposed to contaminants. And also, is this particular herb appropriate for that patient at this time? And that's very difficult sometimes for them to understand because well meaning neighbors and friends will offer herbs and say, this made me feel better during my treatment, but it was a totally different cancer under different circumstances. So those are the ones we want to be very careful about. The overarching though is the purity of it. Are they actually getting what they're paying for, and is it bioavailable? And then is it appropriate in their set of circumstances?
Is this topic gaining traction in cancer research?
Oh, it has been gaining. It has been gaining traction for a while now. And it's interesting to see how much nursing research there is now funded. I think we're going to talk later about some of the resources and where you can find out about some of this nursing research as well as the other research that's being done. When we first asked patients what herbals, the national surveys that were first done, patients or people just answered what they were taking, not why. Then our surveys became more specific. Why are you taking it? Is it symptom? Is the symptom caused by treatment? Is the symptom caused by disease? And then we really started finding out what people were taking. And literally, you can do a search now that what people with say ovarian cancer take for fatigue. It can be diagnosis as well as symptom specific. And that's because of the research that has now been funded.
So, how has studying herbals evolved over the years?
Well, folk medicine, you took what the people in charge of your herbs in whatever countries, what was available in certain countries were just what's available. Now there's a broader exposure to what we can get our hands on. The internet has taken care of that for us. So you could be more specific, and it almost seemed that certain geographic areas use certain herbs for certain reasons. Now that world has become much larger. So the research really has had to hone down on, are you using this herb for this symptom with this diagnosis? One of the problems that patients get into is that they don't think that the herb they're taking for their blood pressure can affect their cancer treatment, or vice versa. Something they're taking for a cancer related symptom can affect their heart, and it can. And when we spoke about ginseng and it raises your blood pressure, it raises your heart rate, you wouldn't want to do that if you had a cardiac diagnosis as well as a cancer diagnosis, and many of our patients do have it. So helping people to understand that something that they take for a comorbidity can affect the outcome of their cancer treatment as well as maybe alter the comorbidity in a negative way.
So, you were talking about how important it is to work with patients and, asking them what they're taking that for. Are there clinics or, specific practitioners that work with these alternative medicines and herbals and things like that, when they are coming in for their cancer care, that we can send them to, or that they could go to help them understand, especially when, you're having to look at things, comorbidities that don't have anything to do with their cancer diagnosis, but yet the impact of how these can cross over and affect that.
Well, when we do our nursing assessment, when we do our initial one and then the updates, because, friends and neighbors are dropping things off to cancer patients, people want to help. They don't mean to do harm. They just want to help. So it has to be updated and rigorously. We cannot possibly keep up with all of the literature we need to keep up with to be practitioners current in the medications, the products used to treat cancer, and all the herbals and what the cross reference would be for cardiac. It's pretty hard to do. But if you get an accurate assessment. My best friend when I was working in a hospital was the PharmD, because that person helped me find the interactions. And at the time, we didn't have the databases that we now have. I have one on my phone that I can check and be about 90%, 95% sure I've got exactly the information I need. But hospitals and pharmacies have large databases and they have access to even more information than I do. So I always have them check with their pharmacist and with the PharmD. And sometimes patients are even more skeptical about telling a PharmD or a pharmacist all that they're taking, because it's not met with, oh, that's great, let me check it for you all the time. Sometimes it's met with, oh, dear God, you're taking that many things. So the person's reaction to them. But those kind of databases are so important to us. And the National Cancer Institute and the National Institutes of Health have done really wonderful job of pulling the information for those databases together.
That's good to know. I think that's going to be an important thing for clinicians that are listening to this and maybe don't, have a good handle on this information or know where to turn. That's a really great resource to have that's probably pretty available to them at their work.
There were surveys done in the 1990s, and they appeared in the ONS journals at the time, that people were afraid to tell, and nurses were afraid to ask. And follow-up surveys found that to be true as well, because nurses were afraid if they asked, then they had to be responsible for all the answers. And we don't have to be responsible for all the answers. We just need to be able to point the patient in the right direction for additional help and get some ourselves from a pharmacist or whomever. And the programs with integrative care programs and the major cancer centers do have those available.
Okay, good. So clinical data suggests echinacea, commonly known as the coneflower, can improve immune function. Can you comment on this and other research currently underway?
Yes. What we know about echinacea is that if you're going to take it, you take it like you would an antibiotic or an antifungal. So 7 to 10 days, once or twice a day, however, in a prescribed way. How our patients were taking them in a recent study was that they thought, well, if they just took a little bit every day and started in October and went till May, those of us who live in the Northeast know that that's winter, and people are afraid of getting the flu. They're afraid of viral illnesses. We now have COVID-19 to think about, that if they took a little bit every day, that they were boosting their immune system. I'd like to say I don't think we should boost our immune system. I think we should support the immune system. I know that the research bears that to be true. The question that's been asked and yet not yet answered is, by taking a small dose every day for that many months, can you fatigue an immune system? And that is something we wouldn't want to risk. Our patients are already immunocompromised when they finish not all cancer therapies, but many of the cancer therapies. And so what we don't want to do is take a fatigued immune system and try to boost it. The best way to support your immune system is actually, interestingly, one study was a cup of chicken broth every day actually helped to raise the white blood cell count and help immunity without overwhelming the immune system.
That's really interesting. So you mentioned COVID-19 and, with the echinacea and boosting your immune system. Another thing that I think something that gains a lot of traction and interest for people is elderberries. And, whether they're, putting that in tea or putting it into a syrup or something like that. Is that along the same lines, would you say, as echinacea, as far as, because I thought it was very interesting how you said that, we could really be not boosting our immune system, but overtaxing it. And I just wonder if that would be considered the same way.
Yeah, that's hypothesized. And the problem with herbals or phytonutrients or spices is the common concept that if a little bit is good, a lot is better. And so therein lies the risk because whether it's echinacea or elderberries, people can have allergic reactions to it. Anything from it just didn't settle well in their stomach to rashes and whatnot. And with echinacea, there are documented cases of allergic reactions to it. So that's another reason why our nursing assessment with the things we're allergic to for years, I remember we never asked if people had trouble with foods or other than lactose. But now you really have to say, are there any foods that bother you? And so it's now very important that we ask about their diet. Are there any foods that they avoid because that doesn't sit well? And people will tell you some vegetables even just don't sit well. Well, if we're taxing the body, we're not doing them any favor. But they will take medicines if they think it's going to be helpful when actually it's not something their body is accepting, I guess is the best word. So with the new treatments in cancer care, we have a new group of treatments to look at and what it means to them. I worked in a traditional chemotherapy outpatient department and have been away from that in a while. So a lot of what we're talking about today, we didn't have then and would have been very helpful to us who were trying to keep our patients safe. So again, keeping track of what the action of the drug is, how it's metabolized, and the possibility of interfering in treatment is always the question to be asked. And if we can't say for sure you'll be safe, then definitely you can't take it now. But we'll revisit this when you've finished treatment and see what else we can find out about that then.
That's a good way to look at it. I like your "if it's good, then more of it is better" approach. I think that's very true out there, especially when, we're talking about these type of supplements, because I don't think probably the general public or our patients or their well-meaning family members and friends, look at or think about things as these can be considered medications almost, and that they can have the same types of effects as medications. And some of these things you need to take, as you were saying about the echinacea, like an antibiotic, and not long term or a little bit every day or really high doses for a long time.
I had a private practice for a while, and I would say to the patients, bring me every tea you use for something constitutional. So, to make you sleep better, to help you move your bowels, anything you take in a tea, anything you take once a year for a headache, and all your prescription meds. And not one single day did anyone walk in with a bag other than a shopping bag, something with handles. It was stunning. It might be something, 6 or 7 things that they only took once a year or twice a year, but the things that people were taking continued to kind of blow me away. The majority of my practice has been in upstate New York, so we are shopping center right next to rural, so we're a combination. But the one thing that was consistent was there was always 20, 25, 30 bottles in that bag. We just have to be really, really careful. We're gaining on it in terms of the research. For a while, when I was first looking up herbs, I was doing home care, and I would go into the homes of the patients. And as a hospital nurse for decades before I did home care, I never saw what was sitting on their kitchen counter. And when I went into these homes and I saw the number of vitamins and supplements and non-name things, little Ziploc bags with what looked like leaves in them, and they were making tea out of it, I became alarmed. And so I tried to do some research. There wasn't a whole lot out there except that the resources I had at the time said frequently used for and a list of things, but it didn't say whether it worked or not because we simply didn't have the research. And that made me think of something. Patients would say, I couldn't find any reason why I can't take this. And the next question is, was there any research at all? No. So there's no research that says it's bad for me. Doesn't mean there's no research, or doesn't mean that there's research that shows it isn't bad for you. It means there might be no research on that particular thing. And think about it. Other disciplines are trying to find out how these herbals are affecting their medications too.
Yeah, I'm sure that was quite an eye opener going into homes. Well, and I mean, I'm not sure where you were practicing at the time, but I'm sure that the difference in going into homes in urban settings versus rural settings is, could be vastly different as well. Or, we are a melting pot country and all of the different ethnic backgrounds that come in and the what kinds of things have come up in their along their histories and things like that. I'm sure there are just so many different interesting things that patients are not telling us, and we do need to really know.
It's interesting. Patients have different beliefs about certain herbals. And I think your earlier comments about we are a melting pot. And so some of it comes from grandma and what she told us, and some of it is ethnic in terms of what you use and when you use it. But the overriding principle, again, is if it's natural, it doesn't mean it's safe. People still say to me all the time, well, it's natural. If it's natural doesn't have any parameters. We don't know what natural really means. So if it's natural, it is not necessarily safe. And we have to understand that all organic is not created equal all the so also. So those are the two big hurdles because American television and internet has gotten that natural and organic language down pat, but it differs. And it may make the difference between something helping you or harming you.
I think that's really a good point, the difference in those, because you do see how people will go out and, buy or think that they can only eat organics. And, with the cost of those, you do worry, especially, you throw that into the financial toxicity that cancer patients have with other issues. And then, if they feel they have to have only organic foods, and it's just kind of, end up going down that rabbit hole with patients. And I think it's important that we as healthcare providers understand those differences and the importance to be able to help them navigate that.
And you see patients who can't afford organic to feel like they're failing in some way. They're failing to keep their mother, father, sister, brother safe because they aren't able to buy all organic. And I know that's not a topic for today, but it's not always necessary to do so.
Right. Yep. I agree with that. So, we mentioned a little bit earlier resources. What resources do you recommend for nurses who want to learn more about this? Because this is such a vast area, and with having to understand and know about treatments and medications that patients are getting and how quickly those things are changing, let alone being able to know what resources they have for, this as well.
I have on my phone Hippocrates, and I can run drug herb indications, contraindications on Hippocrates. It'll tell me what herbs that person shouldn't take, or if I look up an herb, what drugs that person shouldn't be on. So that's the quick and dirty for me. But you have to have some things on your desk. And so I went and looked at my desk and there were 17 things on it. And so I said, no, that's more than anybody really needs. Internet, the National Cancer Institute Office of Cancer Complementary and Alternative Medicine. It's cam.cancer.gov. And the NIH, National Center for Complementary and Integrative Health, is nccih.nih.gov. The National Institute of Health also has the PDQ programs, and there's some for patients and some for healthcare professionals. And it is simply www.cancer.gov, and then you ask for the PDQ because these have been studied there as well. The seminars in oncology nursing, it's kind of an old resource now because it was 2012, ran an entire issue, thank you to its editor, Connie Henke Yarborough, February of 2012. It's volume 28, number 1, and it introduces you to these concepts, what's going on that's positive, what's going on that's showing negative effects, but it also introduces you to the researchers so that you can follow up in an easier way. All of ONS, I mean, all our journals have something about integrated therapies in every issue. And so if you use ONS as a reference. I usually start there too. The other one that I use that is more commercial, is the consumerlab.com. They name names. So if you're looking for a product and you want to know which is the most bioavailable, you can find out at Consumer Lab which brands are the best absorbed, the ones you want to stay away from. And that does require an annual fee, but it is also a quick reference for me when I need a quick reference.
Great. What are some things about herbals that are not often discussed, but you wish people knew more about?
Purity. Those products are not regulated by the FDA, and I certainly am not going to recommend that they be regulated by the FDA, but we have to take responsibility for those little Ziploc bags with leaves in. I would take them to the PharmD I was working with at the time, and he would say to me, please don't bring those anymore, because then he had to try to figure out what they were. But patients were bringing them in and saying, I'm taking this and I'm doing that. And he would call and say, the good news is there isn't anything in here that can harm them. The bad news is that they shouldn't be taking anything in here because they don't know what it is. And it takes a while to find out pharmacologically. And so anything that has to be investigated. And very often they were herbs given to them by alternative, I don't like to use that term, a complementary practitioner, someone who didn't mean to do harm, but didn't understand the impact of perhaps what they were doing. So they were using it as a complementary therapy, except it didn't complement their treatment. It may have jeopardized it.
The little bags with leaves in them. That's wonderful.
Dried leaves. Yes, right.
Exactly. So, as we finish up here, do you have any final comments on herbals, supplements, and spices in treating cancer?
Yes. Purity and bioavailability are issues to be dealt with up front. So we do have to check about that. And there is a resource for that. It's the German Commission monographs, and they discuss purity, bioavailability, but so does consumerlab.com and some of the other resources I named. The appropriate use. Literally last week, I had a friend bring me a list of what a relative of her was taking, and she wasn't feeling very well. And so I said, just stop everything except your prescription medications, because what if it's one of the prescription medications? But there were 19 things on this list, and this woman has one diagnosis, and it's not cancer. And she felt immensely better. And so I asked her why she was taking them. And she said, well, one friend had recommended this, so she took it. And then somebody else recommended something else just for health. And she said they weren't taken for diagnosis, they were taken for general health. And I thought that very interesting. I would have thought that that was almost not happening anymore, but it is indeed. And so we have to be aware that people are taking vitamins and herbs and spices for general health. And several of hers had anti-clotting. She was noticing some increased bruising. So we have to look. Herbs are medicine and have side effects. And that is extraordinarily important. And don't be afraid to ask. Our responsibility is to ask and then to help them find appropriate resources. We don't have to have all the answers. We can't possibly have all the answers.
Thank you, Georgia. This has been extremely informative, and I think will be very helpful for our oncology practitioners that are out there and listening to this podcast.
Thank you, Stephanie.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.